Welcome back, everyone. After COVID-19, Piedmont Augusta's Somerville campus closed its doors. 4 years later, the hospital reopened with updated new units. Take a look at this video from the ribbon cutting this past spring. Hospital administrators hope opening the Wrightsboro Road location will give patients faster and easier access to services with a 15-bed emergency department, a 12-bed inpatient unit, and a radiology department.
With it being a smaller campus to start with, we're really going to be able to focus on that patient-centered care, really making sure that our patients feel valued, they feel heard, and we're just going to really be able to focus on streamlined flow and throughput for our emergency department, really getting patients the appropriate care that they need in a timely manner.
And a lot of that care will be coming from nursing students, thanks to a collaboration between Piedmont Augusta and Augusta Technical College. Brandon Dawson has more.
Piedmont Augusta and Augusta Tech have partnered up. Augusta Tech's Allied Health Sciences are now at the Piedmont Somerville campus. The Piedmont Augusta Foundation raised over $1 million in scholarships for eligible nursing students. Thanks to support from around the community, the scholarships will help students who may not have had the opportunity to attend nursing school.
This is a very condensed program. It is very high-paced and it requires a lot of focus. And so not having to worry about the financial aspect of it allows me to focus completely on the education portion.
The nurses who've received the first 2 scholarships are not only enjoying the program, they're also thankful for anyone that helped make this happen.
I'm able to spend a lot more time at school, and I'm able to spend a lot more time studying. And with my head in the books, then I have to spend at work. And it also gives me more time to spend with my daughter.
These scholarships are sure to help plenty of other nurses achieve their goal.
Completing will be amazing. I'm doing it for me, and I'm also doing it for my children to know that it's never too late to follow your dreams.
And we have 2 guests today to talk about the nursing partnerships between health systems and nursing education programs. Dr. D'Amica Williams is the director of Allied Health at Piedmont Augusta. She's been a nurse for more than 20 years now with a background in acute and critical care. And Laura DeFord, who you just saw in that video, is the recipient of a nursing scholarship from Piedmont Augusta Foundation. And now we can say she is a new graduate nurse. Thank you all both so much for being here today.
Thank you for having us.
Well, I'm really glad that we can explore this subject a little bit. And Dr. Williams, first of all, Piedmont Augusta Foundation has raised more than $1.5 million for nursing scholarships. But aside from that money, it takes community partnerships to make something like this work. What are some of those partnerships?
Sure. So when we decided to partner with the college, we also are augmenting their faculty. So one of the other things that nursing programs struggle with are qualified and or experienced faculty. So one of the things that our college or our hospital has done is actually provide staff nurses who are serving as faculty instructors. So
at Augusta Tech.
At Augusta Tech. Mm-hmm. So they're working for both Piedmont and Augusta Tech. We support the salaries for those faculty. And these are nurses who have worked in our hospital, through the transition to Piedmont and for several years. So they know our health system. And so they really have developed a new skill set too in working with the students. So it allows the school to grow their enrollment so they can use the faculty to actually take those students to clinical and train them in the learning environment in the hospital.
And the hospital that we're talking about too is the Somerville campus.
Correct. So Somerville campus recently opened up a few months ago. Mm-hmm. We opened up for our emergency department opened up, and we also have an inpatient unit for patients that we have to actually admit. So our students at one point, hopefully eventually, will be able to take care of patients at the Somerville campus. But for the most part right now, they're down at the main hospital campus with faculty and, of course, the student groups.
Right, right. Well, Laura, you were part of that student group. You told us a little bit in the video we just watched about what it meant to you to get that scholarship. Tell me a little bit more how that impacted you and your ability to finish your schooling by getting the scholarship.
It meant the world to me. I was working full-time before I started nursing school, and that was one of my worries, is how was I going to pay for everything whenever I was in nursing school. Yeah. So I was still working about 30 hours a week and going to school my first semester. And somebody kind of told me about the scholarship, but they hadn't come out with it yet. And I was like, that sounds too good to be true.
Yeah.
So after the first semester, they came in, Lori Ott came in and told us about the scholarship. And I was like, oh, wow. So this is real.
It is true, yeah.
So I was the first person to call and find out what I need to do. And it helped me so much. I was able to work 15, 20 hours a week versus 30, 35 hours a week and really concentrate on school.
Yeah.
It took down my stress levels. I was able to spend time with my family. Previously, I spent all my time either studying, going to work, or going to class.
Yeah.
And the first semester was difficult, but the semesters after that got even more difficult, and I was spending time at the hospital as well. So it meant that I could study and go to class and have a little bit less on my plate.
And that is good for everybody to hear.
Yes,
That how
it was
that
so
can,
helpful.
Yeah, how that can help. Tell me about the transition to practice for the nurses.
Sure. So we have really tried to, we've got several students now on scholarship that the foundation has supported. And so that's been about a year and a half. So now we've got a very large cohort of students who are on scholarship. Part of that scholarship is that they will come to work at our hospital.
Sure.
Like Laura's been working about
Right.
6 months now, one of our med-surg units. And so part of the transition is that they've learned the facility. So it really cuts down on the orientation time. It takes, depending on the area of the hospital, it takes between $40,000 and $70,000 to orient a new graduate nurse.
Really?
Yes.
Oh my goodness.
And so this really helps our hospital in that these students, they're doing 12-hour shifts with their clinical instructor, who of course
Yeah.
is a Piedmont nurse. And then they've learned the charting system. They've learned where the bathroom is, all the little things.
Sure.
You know, they've really learned the facility. So they've really been brought into the culture. And these are students who are going to be new graduate nurses who are transitioning right into our hospital to take care of patients. So they know the organization. It's been really helpful. So that really supports the transition to practice and helping people feel comfortable. Laura's working on a floor where I know some of the staff there were actually nursing faculty. So she knows the hospital and knows a lot of the things she did for the last, 3 semesters of school.
Wow.
So she's really been there already a year before she even started as a new graduate nurse.
That really makes a lot of sense. And you are streamlining a lot of those things.
We are
Yeah.
able to put some of these students to hire them as nurse externs so they can start as a nursing student working in the hospital and make a decent, salary, just a minimum amount of hours while they're in school because they still don't want to work a lot. But that helps them even more. And those students who extern are actually paired up with a nurse so they can really practice some of their nursing skills that they've learned as a
Yeah,
student.
so they like have a built-in mentor that way.
Correct.
Yeah.
Yeah, it's been really helpful.
Wonderful, wonderful. That is so good to know. In the big picture of all of this is, how does this sort of partnership between like university and Augusta Tech, how does it impact the workforce in our community?
Well, it strengthens it. One of the reasons why we really targeted Augusta Tech was we knew that 90% of their graduates stay in the CSRA.
Yeah.
And that's really what we needed. You need for patient care and for quality outcomes, you really need continuity. We just came out of the pandemic.
Right.
We really still just came out of the pandemic. And so we had staff sometimes that were on travel assignments here for a temporary amount of time. But if you can grow your own and support your system, that just really communicates to, nurses know policies for a facility, they know who to talk to, and it really just helps support, quality outcomes.
I love that. I love that. We do hear so much about the travel nurses and how vital they were, especially during the pandemic. But in terms of your overall benefit for the community, you do want the nurses who are going to stay here.
We do.
And that's how you see yourself, Laura.
Absolutely. I work on a floor that has several travel nurses present every single day. And there are patients on my floor that have been there for longer than just a few days. And so I was telling Dumika when we got here, a lot of the patients' families, I'm the familiar face.
Yeah.
So I'm the person that they'll come to if they have a question or concern, and I'm just the person that they're comfortable asking, where's the vending machine?
Yeah.
What time does the cafeteria close?
Right.
They know my name. So it's nice to kind of be the the constant.
Absolutely, absolutely. And I know you're a great ambassador for Piedmont Augusta too. I can tell that about you already.
Thank you.
Dr. Williams and Laura, thank you all both so much for being with us today and talking about this program. You can learn a lot more by going to our website, WJBF.com, and click the JENNIE link. We'll be right back.